Welcome, everybody. I know we have a lot of people popping on as we get started here. I am so excited to share with you tonight. I'm Denny Benedict, and I'm a holistic health coach, and I'm a national marketing director with the Juice Plus company. And I have the privilege of moderating our panel tonight. And I'm super excited to share with you our panelists. You're going to hear from Dr. Eric Goulder, who is a board certified preventative cardiologist, as well as his wife, Dr. Barb McClatchy, who is a dentist. And she and Dr. Goulder are the founders of the Heart Attack and Stroke Prevention Center in Central Ohio, and also of Complete Health Dentistry of Columbus, which is a partnership between medicine and dentistry that operates under the same roof in Columbus. And they are the first and only practice to do so. So you're going to be super excited and learn so much by hearing from them. And I'm also really excited to introduce to you Dr. Eileen Netzel, and she is a dentist who practices with her husband and several other dentists at Ashland Dental and Wellness in Chicago Heights, Illinois. So I'm going to stop my screen share for a minute here, and I'm going to tell you a little bit more about these amazing people. I have learned so much from them, and I'm so excited that you get to hear from them as well. So Dr. Eric Goulder grew up in Central Ohio, and then he graduated from Oberlin College. He graduated from the Ohio State University College of Medicine, and then did his internal medicine residency and his cardiology fellowship at Riverside Methodist Hospital here in Columbus. He is a board certified in internal medicine as well as cardiovascular disease. He's practiced what he would now call standard of care or end stage cardiology for 12 years here in Central Ohio, and then 12 years in Marietta, Ohio. And during that time, he practiced general and invasive cardiology. After being introduced to the Baldonian method of heart attack and stroke prevention, he has since devoted his practice full-time to a preventative approach to cardiovascular disease. The Heart Attack and Stroke Prevention Center of Central Ohio has been open for nearly 4 years and is a collaboration between Dr. Goulder and his wife, Dr. Barbara McClatchy. Their mutual goal is to knock out cardiovascular disease at the top of the list as a leading killer in our country, where it's been for over 100 years. So welcome, Dr. Goulder. Dr. Barb McClatchy practices general dentistry with a focus on the oral systemic connection within the Heart Attack and Stroke Prevention Center. And their mission is to enrich the quality of life for every person that they meet. And I love that about them. They both have such a huge heart. She is a graduate of the Ohio State University College of Dentistry and went on to do general practice residency training at the Ohio State University. She's also a graduate of the world-renowned Pankey Institute Advanced Postdoctorate Training, and she's a Baldonian preceptor practicing the oral systemic connection since 2011. That focuses on preventative personalized care. And she's a founding member of the American Academy of Oral Systemic Health, which brings the medical and dental professionals together to be better advocates for their patients' health. She lives in Powell, Ohio, with Dr. Goulder and their 2 golden retrievers. She's also a grandma to 3 beautiful granddaughters. She loves fireworks, to garden, to dance, to laugh, and to ride roller coasters. They are both quite adventurous. And get this, together, Dr. Goulder and Dr. McClatchy enjoy touring on their motorcycle, where they crossed the country from Bar Harbor, Maine to Key West, Florida, and then west to the national parks in Utah and Yellowstone. Sounds like a good time to me. So
all except for Kansas.
Gotcha. And then I also want to really just thank Dr. Eileen Netzel for being with us as well. She was raised in Flushing, Queens, New York, and she completed her undergraduate degree at St. John's University in Queens, New York. And she received her Doctor of Dental Surgery from Marquette University Dental School in Milwaukee, Wisconsin. She completed a dental residency at Ravenswood Hospital in Chicago and she met her best friend at Marquette, and she married him in 2000. And she practices with her husband in Chicago Heights. Her practice is based on complete health, not only for her patients, but also for her team, herself, and her family. Like Dr. Goulder and Dr. McClatchy, Dr. Netzel is a graduate of the Bale-Doning Preceptorship. She's also a member of the American Academy of Dental Sleep Medicine, the American Academy of Oral Systemic Health, and the American Academy of Facial Aesthetics, to name a few. Eileen and her husband Joe have three wonderful children who are at the center of their universe, as they should be. Dr. Netzel loves to learn new things that will make her life better and healthier. And then she loves to share that knowledge with everyone she cares about. She truly believes that knowledge is power. And that's exactly why we're here with you tonight, to share knowledge that can empower you with information that can positively impact your health and your life if you put it into action. All four of us are also partners with the Juice Plus company, and we share Juice Plus with patients, with family, and with friends. And I'm also blessed, very blessed, to call each of them my friends and partners in our mission of inspiring healthy living. So let's go ahead and start with some of those questions. I'm going to share my screen. All right. And I'm going to start out with you, Dr. Goulder. And I've got this beautiful image of the root cause of disease tree. Dr. Goulder, why would a cardiologist and a dentist practice together?
And so, well, thank you for the great introduction, Denny. And that's a great question. And if you look at the center of that tree, it says inflammation, and that's why Dr. McClatchy and I are practicing together, because inflammation is the cause of all arterial disease. It's the cause of most chronic disease now. And so, we used to think that when I was in training, we used to think that, well, that arterial disease is a cholesterol storage problem, but it's really not. It's an inflammation problem. If you don't have any inflammation, you're not going to develop arterial disease most likely. And so we're practicing together because if you look underground on all those root causes, you can see that all the way over on the left it says airway sleep or disturbed breathing patterns. Along with in the middle there's periodontal disease and endodontic disease, which is root canal disease. Those are dental problems, and I'll tell you, I can't diagnose them, I can't treat them. That's why I need to practice with a dentist who understands the oral systemic connection.
Right. And how fun that she's your wife.
Absolutely. People keep asking us, how do we find someone to practice? And we keep saying you just marry him.
It worked for me.
See?
So I know the CIMT is one of the initial tests that you do. Can you explain what that is and why that's so important?
Sure. So the CIMT, that stands for Carotid Intima Media Thickness Scan. It's an ultrasound scan, and it's looking at the lining of the arterial wall. It's looking at the intima is the first portion of the lining. The media is the muscle layer. And on the scan, they look the same. So we measure them both together. But we know that if there's problems going on with arterial disease, that's all going on in the intima. So if the lining gets thicker, that means there's cholesterol and inflammation starting to build up. Like you might see if you look at the top of the tree, and I don't think my pointer will work it, but up at the top of the tree over on the left-hand side, you see a normal artery cross-section. And then you see some yellow streaks in it. And that's supposed to represent an increased arterial age with cholesterol and inflammation starting to build up in the arterial wall. You can get, it's an ultrasound scan. It takes 15 or 20 minutes to do. You don't have to disrobe. It's just looking at the carotid arteries right in your neck. We just put some Vaseline-like stuff on your neck, some gel, so the ultrasound beams can travel through that, and we can see what the walls of your arteries look like. And if they're thicker than they should be, then you're going to have an increased arterial age, and that's you're going to have an increased risk. If there's plaque, you're going to have an even higher increased risk. But the reason we do this is because, if you think about what we do for other chronic diseases, everybody goes and gets their blood pressure checked, and they know if they have high blood pressure or not. But what if nobody checked their blood pressure until they had a heart attack or stroke, and then they said, oh, we checked your blood pressure, it's elevated, we should treat that? Or what if you never got the pressure in your eyes checked at your eye doctor until you started losing your vision, and then he checks it and says you've got glaucoma and you're losing your vision because of that. We should treat it. Well, that's what we do in this country with arterial disease. We wait until you've got a problem bad enough to make your stress test abnormal before we go to look and see if you've got arterial disease. And we don't do that for anything else. We should be looking at and checking when you're 40 years old to see if you've got arterial disease. If you don't, great, let's check you again in 5 years. But if you do have arterial disease, early disease, let's do something about it now before it becomes a problem. Because the real problem with arterial disease is you don't have a symptom until you do. Okay, and the presenting symptom for arterial disease is usually a heart attack, or stroke, or dropping dead. Half the time, that's the presentation. The other half are the people who are lucky and they get chest discomfort, shortness of breath, fatigue, and they go see their physician and maybe gets figured out. But half the time, the presentation is something really catastrophic. So let's look and see beforehand so we can prevent that from happening.
Thank you for that. And I've learned so much from listening to you speak about this. And you say that inflammation is what drives hardening of the arteries. So what is that based on research? How do you know that?
Yeah, so the initial research on this really goes back probably 25 or 30 years. Dr. Paul Ridker at Harvard is a cardiologist there, and he did the initial work on a protein called high sensitivity CRP, C-reactive protein. So when that's elevated, that says there's inflammation in the lining of the arteries. Okay, so a lot of doctors check that now, but that's about as far as they go. And there's several other inflammatory markers that we look at, and we know that if your inflammatory markers are elevated, and these are things that we check routinely on our patients, if they're elevated, you're probably continuing to develop arterial disease. So we want to treat whatever's causing it. All those things underground are potential sources of inflammation. If we treat all those things optimally, the inflammation settles down and we can watch your CIMT get better. We can watch your arterial age shrink back down towards normal. We can watch plaque, if you've got it, become less and less inflamed and have less cholesterol in it, and it calcifies and stabilizes. And we know that it's inflammation because Dr. Ridker did a great study about 3 or 4 years ago called the CANTOS trial. It's spelled CANTOS. And in a nutshell, he gave half this population a drug that blocks the last step of the inflammatory cascade, and the other people got placebos. And the people who got the drug had far fewer heart attacks and strokes than the people who got the placebos. So we'll never use that drug that he used in the study because it's way too expensive. It probably costs a couple $100,000 a year. But we know that if we get all your inflammatory causes under control, we don't need that drug because we can stop the inflammation process and stop the arterial process dead in its tracks.
Great. So I know I love the title of this event, Heart Attacks Are Optional. How can you guarantee that your patients will not have a heart attack or a stroke? We don't hear that traditionally from cardiologists.
No, we don't. And so, I think that most cardiologists are probably too busy doing what they do, doing non-invasive cardiology and echocardiograms and stress tests and seeing people in the office, or putting in pacemakers or electrophysiologists, or doing ablations to stop atrial fibrillation or rhythm problems, or they're doing heart casts and putting in stents to really do prevention, which takes a little bit more time. And I think that that we know that doctors Bale and Deneen have been doing this for probably 25 years in separate practices now. And over 25 years, they've only had 2 patients who've had a cardiovascular event, a heart attack or a stroke. So we know what works from a clinical standpoint. I also know that from studies that they've done in conjunction with Johns Hopkins, that if we treat our people like we talked about, find all the sources of all the root cause of inflammation, get those under control, watch the inflammatory markers come down and stay down, that over a 5-year period, we get all the cholesterol and all the inflammation out of the plaques, and they turn into calcified rock piles that are much less likely to rupture and cause a cardiovascular event. It's the inflamed plaques, it's the soft plaques that have cholesterol, and your body's response to that cholesterol being in the arterial wall, which is the inflammation, that allows the plaque to grow and and it makes the plaque rupture and cause event. It's not the plaque that causes the heart attack or stroke. It's when that there's a thin fibrous cap over the plaque, and when it ruptures, your body tries to heal it with a blood clot, just like when I cut myself shaving, which my wife will tell you I do it all the time. So, and you get a scab there, right? You get a scab where you cut yourself shaving, and the same thing happens inside the artery. We're going to call it a thrombus, but it's a blood clot inside the channel where the blood flow is supposed to be going. And if it plugs it up completely, then you're going to have a heart attack or stroke. So if we get all the inflammation out of the arterial wall, it's not going to rupture and it's not going to cause an event.
Thank you for that. That's a great explanation. And, when I was introducing you and saying that you had 24 years in standard of care practice, and I know that's very different from what you do now. Can you explain the difference between the two?
Yeah, so I'm a lot older than you think I am because it was actually 35 years of standard of care medicine.
Giving you
And
the
what I tell my patients is I did that for 35 years. I'm a slow learner because now I don't do that. I still practice the standard of care, but I go beyond that. So the standard of care to me means that there are guidelines handed down by the American College of Cardiology, the American Heart Association. Every year they come up with new guidelines, and the guidelines are how to treat everything in cardiology. How should I be treating a heart attack, a stroke, high cholesterol, diabetes, high blood pressure, rhythm problems, congestive heart failure, anything you can think of in cardiology, weird things, cardiomyopathies, anything you can think of, there's guidelines on how it should be treated. Okay. And if you treat all your patients by the guidelines, and there's some wiggle room in there, but if you treat them by the guidelines, you're practicing standard of care cardiology. And so I still do that stuff. Okay. But I go beyond that because, for instance, if I have a patient who has never had a cardiovascular problem, but I do, like, take me, for instance. I've never had a heart attack, a stroke. I've never had a bypass or a stent. So, but I've got arterial disease. I've got plaque in my carotids, both sides. Okay. Thank you, mom and dad. Because they gave me something called LP little a, which is very atherogenic. So I've got arterial disease. I've never had an event, but most doctors would not have done a CIMT on me to look and see if I've got arterial disease. A few might have done a coronary calcium score on me, and that would probably be positive. And then you'd get more aggressive. So more aggressive meaning that if my total cholesterol was 200 and my LDL was 100, most doctors would say, you're good. You don't have a history of arterial disease, you're good. But I know that if I want to regress my disease, I need to be more aggressive than that. I need to go beyond the standard of care and practice optimal care, which means my LDL should be under 70 and my total cholesterol should be under 150. And there's some other markers I should be doing more aggressively too. So that's an example of one of the differences. We go beyond the standard of care. Different testing. We do genetic testing, which most doctors are not going to do, looking for people who have high risk markers for arterial disease. We look for people who have certain genes that would say we have to treat you differently with some of our lifestyle modifications. And most doctors don't do genetic tests either.
Well, speaking of lifestyle modifications, I know part of your protocol involves a very strong focus on lifestyle. Why is that important?
So we know from a lot of studies, there's studies of 20,000 men, and there's the nurses study of 90,000 nurses been followed for 25 years. And they show you unequivocally that if you optimize your lifestyle, meaning things like eating a good diet, not eating a lot of processed foods, not eating a lot of red meat, eating more fish, chicken, lots of vegetables, good fats, not a lot of dairy products, full fat cheeses and whole milk and that sort of stuff. You exercise a minimum of 22 minutes a day, which is 150 minutes of exercise a week. Your waist in men is under 37 and a half inches. Your blood pressure is good, top number being 120 or less. Your cholesterol under 200. If you get all that stuff like that, and you're following that good lifestyle, we can avoid 79% of the heart attacks that happen. Wow. 79% just by doing what we do. We never used to have the lifestyle we did. If you look at the chart of cardiovascular disease, it started ramping up about 1920. And it just keeps on going up, 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 up. And it doesn't level off until 1960, when the Surgeon General's report comes out and says that smoking is causing cardiovascular disease and heart attacks and lung cancer. And then then comes in the late 70s comes open heart surgery, and we're starting to get ahead of the curve a little bit, and things are starting to ramp down a little bit. And then we've got stents and balloon angioplasty, and things are coming down, but we're still the leading cause of death. But if when this started, what was our lifestyle? We didn't eat processed foods back in the 1900s. We didn't have cars to drive everywhere. We walked or rode bikes, and the smoking wasn't a big problem. Smoking started getting popular when the government gave everybody cigarettes, all the GI cigarettes in World War One. And then everybody comes home and they keep smoking. So anyway, our lifestyles changed a great deal since then. Obesity has become a big problem in this country over the past 30 years. So yeah, our lifestyle has changed a lot. We need to get back to that good lifestyle. That would make a big dent in the cardiovascular disease.
That's amazing. That's a huge reduction.
Yeah.
I mentioned earlier, you recommend Juice Plus to your patients. Can you explain to our audience why that's a part of your protocol?
Yeah, so Barb had actually introduced me to Juice Plus, and you introduced Barb to Juice Plus, and we've been doing this. Probably been 10 years now that we've been doing Juice Plus, and she's got her own story. but for me, what I really like about Juice Plus is diet is so important in lifestyle, and you need to be eating your fruits and vegetables. If you ask your patients, do you eat fruits and vegetables every day? Well, yeah, I had a bowl of cereal and I threw some blueberries on it this morning, and lunch I had a salad that had a couple carrot strips and a slice of cucumber in it, and dinner we had broccoli. Well, that's not enough. And so for me, Juice Plus fills in the cracks. It's sort of like they said about Jello after dinner, right? There's always room for Jello. It fills in the cracks. So don't eat Jello. But anyway, it fills it. It makes up the difference between what you're eating, what you should be getting in the way of fruits and vegetables every day. And what I really like about it is it's not, there's lots of stuff advertised on radio and TV of supplements for fruits and vegetables. Juice Plus does not consider itself a supplement; it's just food. But Juice Plus has 41 placebo-controlled randomized double-blind studies that say it does what they say it does. And what they say it does is, number one, it's bioavailable, which means you're going to take it and your body's going to absorb it because it's food. Your body knows what to do with that capsule of food. It decreases inflammation. Barb's going to tell you about that. It decreases gingival, your gum inflammation. It decreases cardiovascular inflammation. It improves your stamina. It makes people have less trouble with infections when you take it. And we've talked about this before. But my favorite study is the study from the Austrian Special Forces. So these guys all ate together in the mess hall together. They all slept together. They all worked out together. Everybody did the same thing. And they gave half of them Juice Plus and half of them placebo. And 90 days later, they checked everybody. And they had baseline stress tests on them. And so they checked them again and did stress tests on them. The guys getting the Juice Plus had more endurance. They lasted longer on the stress test. They recovered quicker from the exercise. And they had fewer upper respiratory infections over that 90-day period. And so the Austrian government started giving it to all their Olympians. So yeah, so it does there's proof that it does what they say it does. And so I love Juice Plus for that reason. I recommend it to all my patients. And I don't twist arms, but I recommend that you should be doing this because I guarantee you that you're not getting the fruits, except for maybe my vegan patients, but you're probably not getting the fruits and vegetables you should be getting. And you're not getting the variety.
Right. That's a big part of it. And it's also something that's so simple and convenient and inexpensive. It's an easy
Right.
way for the patient, for anyone, to take responsibility for their health and do something really super simple. So thank you so much
Yeah.
for sharing all that with us, Dr. Goulder. Dr. Netzel, I'm going to come to you next. So what are the three main conditions that you as a dentist are looking for in your patients to help reduce their risk of heart cardiovascular disease?
Well, it's interesting because as a dentist, I get to see red flags that most people don't see, and it's all in the mouth. And a lot of our patients, I should speak, a lot of my patients, I'd say about 50% don't even have general practitioners they go see. If they have an issue, they go to urgent care. So they don't have someone who's keeping track of their blood pressure or their cholesterol or anything else. So I'm blessed in the fact that they come see me twice a year. So I can keep track of them, not only dental health wise, but also kind of systemic health wise also. So when I look in a mouth, I look to see the red flags. So what am I looking for in the mouth? I'm looking for signs of dental disease or gum disease. When I say dental disease, I'm talking about cavities. Do you have a cavity, or do you have gum disease? Are your gums swollen, red, puffy, bleeding upon touching? Is there pus? There can be pus at times. Or a bad breath will also tell me that there's something not good going on. I also look for abscesses on x-rays, or if there's a really big cavity, I'm pretty sure the nerve has died and now we've got a locked-in infection in the jawbone, which only increases the inflammation throughout the entire body, increasing your chances of heart attack or stroke. And I also look for sleep apnea. You know, there are red flags in the mouth that say this person might be having issues with breathing at night, and sleep apnea is not breathing at all for 10 seconds or more while you're sleeping, or your breathing becomes excessively shallow. I tell patients it's like breathing through a coffee straw. If you tried doing that while you were awake, you'd pass out because they're not getting enough oxygen. But when you're asleep, you don't notice it unless you've got a partner who says you're snoring a lot, or I notice you stopped breathing and then after a while you take a big gasp of air and then you go back to sleep again and back to the snoring, and it's an endless cycle. Patients feel that they're sleeping fine. They're not waking up. They're not feeling any different, or at least they don't know any different. But then we start asking questions and we get to the root cause of the sleep apnea. And then we start talking about how to treat that, how to make them better from it.
That's so great. It's so above and beyond. And I just absolutely love that you have the whole body as a concern when they're coming to see you for dental care. Dr. McClatchy and Dr. Netzel, you recommend 3 tests with your patients. Can you explain those tests and how they're different from standard dental screening? Why are they important?
Who's going first, me or you, Barb?
Well, I'll start.
You got it.
We do saliva testing. We know that periodontal disease is a chronic inflammatory process that's driven by bacteria. And when we see periodontal disease, we want to individually treat that patient's periodontal disease, but we want to know what we're working with. We want to know what bacteria is present, and we want to know how aggressive that bacteria is. We do know that there's 5 high-risk bacteria that are directly related to cardiovascular disease. So that's especially important in our practice because every one of Eric's patients has a saliva test. So we are testing for 11 high-risk bacteria, with 5 of them focused on cardiovascular disease. And it's a simple swish and spit of some salt water that we spit into a test tube and send it off, and we get the results back, and that helps with our treatment of how to decide what therapy and what type of products this patient is best treated with. Another thing that we do is we have a 3D cone beam, which is a 3D x-ray that misses our standard of care. 2-dimensional x-rays can miss a lot of infections, and especially find infections at end of root tips, that the end of the roots, that you may not even know you have a problem with. So this 3D cone beam x-ray is actually used for both practices because it's got a big field of view, so we can evaluate the TMJ jaw joint. We can look at the sinuses. Do they have any cysts or polyps? Deviated septums, which has to do with our airway. Any infections at the root tips. We're looking at airway. We can measure airway, and that's at its best possible size because the patient is actually standing upright in this machine, and it's not like laying in bed on your back where your tongue falls back in the back of your mouth. So it gives the best case scenario of your airway by standing up. And it can also point out if they have calcifications in the carotid artery, as Eric was talking about. Once you have soft plaque that calcifies into hard plaque, we can actually see that on an x-ray. If it goes down, far enough, which ours does. So many times a patient will be having a toothache, and we'll be doing a scan for toothache and find out that when we have the radiologist read the report that they have calcifications in the carotid artery. So that allows us to have that conversation and for me to introduce the patient to Dr. Goulder, who then can discuss cardiovascular disease. So we use some of that testing between both practices.
The third test is a sleep test. We use it at our office. It's an FDA certified take-home Knox 3 sleep machine. It's nice because you get to sleep in your own bed. You don't have people staring at you like they do at a sleep clinic, and you don't have 18 leads stuck to your head and they're telling you, take a good night's sleep so we can test you and see how you're doing. So you get to sleep at home. We show you how to do it. You take it home, you put it on your PJs, and you go to sleep. And the next day you drop it off, and within 5 minutes, we know whether you're suffering from sleep apnea and at what severity. We also know if you're clenching or grinding your teeth. That's one of the great caveats of this machine, because one of the highlights we look for in your mouth, one of the red flags is, are you clenching or grinding? You know, in the past, when we went to dental school, they told us, oh, if a patient is clenching or grinding, they're under a lot of stress. You need to make them a night guard so their teeth are protected. Well, research has shown that those night guards are actually sometimes triggering sleep apnea or making it worse for those who haven't been identified with sleep apnea yet. So in our office, we don't make your standard night guard to get your clenching taken care of. We want to see, again, the root cause of your clenching. Is it something that you just do on a regular basis, or is it triggered by your lack of breathing at night? So it makes it more comfortable for the patient and more accessible to sleep at home and get it done.
Great. Thank you for sharing that. And just like with Dr. Goulder, with both of you, lifestyle is really important in your practices, and you both recommend Juice Plus to your patients. Dr. Netzel, Dr. McClatchy, can you explain why you recommend Juice Plus to your patients, and what's a little bit of your history with it?
Well, I have a fabulous cardiologist that takes care of me personally, and he recommended it to me. And of course, I do as I'm told. So I started Juice Plus. I like the fact that it does supplement everything I don't eat. I'm not a healthy eater. And by far, I'm not a healthy eater. I don't really like vegetables. I really don't like fruit. And if I do eat fruit, it's one of two things. So I don't have the variety that Juice Plus gives me. So it's nice to know that I can take these whole food capsules and it's making me healthy internally. I recommend them to my patients because we do everything we can to end inflammation in the mouth itself. But I like the power of ending inflammation in the mouth, but then also systemically at the same time. So it's kind of like a 1-2 punch to get rid of that oral inflammation and get our patients healthier.
Right. Thank you for that. What about you, Dr. McClatchy?
Very similar, as Eric mentioned about all of the research articles. Our patients look to us as their dentist, doctor for advice, and I can't recommend a product unless I know it is a reputable product. So first of all, I had to really do my own research and start taking it myself before I started recommending that to my patients. I also found that the patients that did start taking Juice Plus was healing much faster after extractions and or periodontal therapy. And I explained it to the patient as, the hygienist is doing the therapy and kind of working from the outside in to get them healthy. And by having Juice Plus in their system, it actually accelerated their healing, improved their immunity, their anti-inflammatory, antioxidants, and felt like the patient was getting healthier. And I would witness that. From my own standpoint, I have to make a true confession here that I just told my husband this morning is, as a patient, he does blood markers every 3 months, which is, part of the root cause tree. So those are your markers, so you know how well you're doing with all your inflammation markers. And I was having some concerns of some other issues, and I went and saw a functional medicine physician. And he had given me a lot of supplements to help me with some other situations. And I found with all the supplements that he gave me that I started cutting back on my Juice Plus because it just seemed like I was taking so much. Now, nobody knew this.
We call this pill fatigue.
Pill fatigue. And so I figured, well, I'm still adding my supplements. I'm still doing, still helping my body. And last week I just had my quarterly blood draw and I saw my inflammatory go up almost 3 times from what it was in January. And, I had an aha moment to myself. because I did not practice what I was preaching. I have for many, many years, but I just did a little caveat and started with these other supplements, not related to fruits and vegetables. It was more specific to my stress and brain fatigue and things like that I was going through. And you have an objective test. You have a blood test that lets you know actually what's going on in your body. So I had my aha moment. What did I change? Other than adding a little stress, I didn't change a whole lot. I did my own research. and guess what? We're getting back on Juice Plus. So I just told him about that this morning. He had no idea.
Well, you
Two
know what?
confessions.
It's funny to hear you say that, because I can't tell you how many people I've talked to over the years that I've been involved with Juice Plus who have said the same thing, where they've stopped taking it and they come back. They're like, I don't feel good. I didn't realize how good I felt until I stopped taking it. And you're actually seeing that in your test results. So thank you for being vulnerable and authentic about that.
Authentic, yes.
Thank you for being inflamed.
In the sake of time,
I got some work to do.
in the sake of time, I know we're approaching the end of this. I just wanted to share a little bit about Juice Plus. This came into my life 19 years ago. My wonderful sister Wendy, who's a retired nurse who's on the call tonight, told me about it. And I had been dealing with an autoimmune issue for 20 years, pretty severe fibromyalgia. And I really didn't expect too many changes. But what I noticed pretty quickly is what we see happen for a lot of people, which is increased energy. My bowels straightened out as far as I was constipated all the time, and I wasn't anymore after Juice Plus. That was worth so much to me, and it's a problem with so many Americans. And I started to crave healthier food, exercise more, and making simple changes over time led to about a year, 18 months after starting Juice Plus, after having fibromyalgia for 20 years. I didn't have it anymore. And I've been symptom free for 18 years. And I'm really grateful for that. And it really fuels my fire to go out and let people know, listen, this is simple. It's fruits and veggies in a capsule or a soft chew. And it's a great way, like you said, Dr. Goulder, to bridge the gap between what we eat and what we should be eating every day in terms of a wide variety of fruits and veggies. So I'm sure many of you who are hearing about Juice Plus for the first time are saying, okay, what is it? Well, the mission of the Juice Plus company is to inspire healthy living and to have a positive impact on the communities that we serve. And we provide high quality products that are backed by 20 plus years of clinical published independent research, as Dr. Goulder mentioned, and all the doctors mentioned. And our emphasis is on whole food, plant-based nutrition that is so, so important in a healthy diet. And so we help to bridge the gap, as you've heard from these wonderful, wonderful panelists, between what we eat every day and what we should be eating every day. And I'm just going to show you a quick screen share on what's in Juice Plus so you can actually see it. We have 3 different blends of fruit, vegetable, and berry capsules. And by taking 2 of each capsule every day, less than that for a child, you are actually getting the nutrition of 30 different fruits, vegetables, berries, and grains. And then we also have a vegan plant-based omega. So there's no fish burp. We go straight to the algae for that alga oil. And that's where the omega-3 comes from. The fish eat algae in order to get omega-3 in their skin, and we go right to the algae. And then we have 5 other plant oils. So you're actually getting a broad spectrum of omegas, omega-3, 5, 6, 7, and 9, in the ratios that your body needs. And so it's so simple, convenient, and inexpensive. And I'm not going to go into this a whole lot because the doctors have shared this with you, the clinical body of research. This is what separates us and makes us different from any other product on the market. It promotes healthier cardiovascular wellness, reduces inflammation, supports healthy cholesterol, LDL, triglyceride metabolism, healthy lungs, skin, gums, supports a healthier immune system. I mean, coming out of the last year and a half, who doesn't want to have a stronger immune system? And this is such a simple way to help do that. It helps maintain healthy DNA, reduces oxidative stress or free radical damage, and it's absorbed by the body. And I love this quote by Dr. Richard Du Bois: there is nothing else available any place in the world, with or without a prescription, that has been proven to do what Juice Plus has been proven to do. And that is so true. The only last thing I wanted to share with you all is that we have the children's, it's called the Healthy Starts for Families program. We've been doing this for over 20 years, and over 1.5 million families around the world have participated, where basically when an adult adds Juice Plus to their diet, they can sponsor a child, a grandchild, a neighbor, anybody that they know, ages 4 to 18, or a full-time college student, who can take Juice Plus for free for 4 years, which is amazing. That is the heart of the company. And they're seeing that these kids, because it's a survey study, 60% are missing fewer days of school. They're taking less medication. They're drinking more water. They're going to the doctor less. They're consuming less fast food and soft drinks, and they're seeing some kind of a positive health result. As a mom of 3 adult children who have been on Juice Plus for 19 years, I've seen all of this, and it's invaluable to me, and it's free. So I just wanted to share that with you as well. I'm going to come back to our panelists to quickly wrap this up. And I just want to ask you, what is one simple thing that you can share with our guests to take with them?
I'll start. I wanted to bring up how convenient Juice Plus is. We talk about eating all the fruits and vegetables, and we all go to Whole Foods and pick out our organic fruits and vegetables that we want for the week. And we tend to pick the same 10, 12 favorite foods that we get every week.
I pick stuff up. What the heck is that?
And bring it home, and then life gets in the way. And how many times have we all thrown out expensive, beautiful fruits and vegetables because we didn't get to it frequently enough? Or we pick the same vegetables and we're not getting 30 different varieties as Juice Plus, so we're missing out on the nutrients that the other fruits and vegetables offer. So it is a very convenient way to stay healthy, eat organic, and eat healthy. So I find it very convenient as trying to run a busy life.
Yes, very much so.
So for me, I would say I cut you right off, Eileen. Go ahead, Eileen.
No, that's fine. That's fine.
Sure.
Thank you. As a mom, who's got 3 kids who are all going in different directions, it's hard to get a nice, full, well-balanced meal on the table every night, especially if I'm working late or the husband's working late or there's tests and all that going on. So I like what Juice Plus does for me. But I also like the fact, I fell in love with the fact that our children get it at no charge on top of that, which just shows how the company stands by what they're doing and that they actually care about the family unit. It's not a quick buck kind of thing. What I love seeing is that my middle son, who's got horrible seasonal allergies, ever since he started using Juice Plus, his seasonal allergies, I say, were cut down by about 75 to 80%. Which is amazing, because every day it was take a Zyrtec before you go to school because you're not going to make it. And then during COVID, you can't sniffle, you can't sneeze, you can't cough because they'll send you home, and you can't go back to school without a COVID test. And I know him. He'd be getting a COVID test every day if the way his allergies were going. And now it's just rarely does he have to take an allergy pill. He's not up at night because he can't breathe. It's just wonderful. And I'm so grateful to that, because they don't like vitamins and they don't like to eat healthy. They got that genetically from me. So it makes my life easier. It brings me peace as a mom, knowing that I can give them something that will help them. I'm a big proponent of, what you did 10 years ago in your life, you see now. And it's always better to have started 10 years ago on the healthy lifestyle and taking care of yourself. But there are reasons for everybody on why they didn't do it. And it really doesn't matter right now. The second best time is now. Mm-hmm. So what you do now from your mouth, from your heart, from your health will show 10 to 15 years later. So, let's start now. Let's forget about the past and move forward.
Great advice. Great advice.
I don't have COVID, by the way. So for me, I think the biggest, maybe one of the biggest takeaways for everybody should be that how important a healthy lifestyle is for preventing cardiovascular disease. If you exercise a little bit every day and you're not eating a lot of processed foods and you're not eating a lot of fast foods, lots of fruits and vegetables, you're going to go a long way toward preventing arterial disease. And then the next thing is get a CIMT done. It's hard to find where to get it done, but get a CIMT done and see if you've got arterial disease, because now is the time to prevent it, not 20 years from now when you're having an event.
You could have it done at our office February 25th of next year. Eric's coming out with Barb to get it done at our office. We did it last year. It was amazing. I'm so excited about next year.
Yeah.
That's
Yeah,
great.
that's amazing.
Yeah.
Well, I just want to thank you so much, Dr. Golder, Dr. McClatchy, Dr. Netzel. You are amazing and you are such giving human beings. And I am so grateful to have learned this from you a while back, and I continue to learn. And I'm so grateful that you took the time to share with all the people on the call. And I want to thank each of you for being here. We will get the recording out. I've seen a couple chats come through asking for a recording. We'll be sure to get that out. And Henry, you can go ahead and stop that recording, and then we can unmute ourselves, and let's give our panelists just a big thank you for